Good evening and welcome to WMBC Hometown. I'm your host, Avni Lall. Thanks for joining us on this Saturday evening. We'll be sitting down with Dr. Arnold Pallay, Medical Director of Vanguard Medical Group, to discuss prescription drug abuse and safety tips on how to combat addiction. We'll have that interview later in the show, but first up tonight. And coming up next, we sit down with Dr. Arnold Pallay to discuss prescription drug abuse and how to combat addiction. Welcome back to Hometown. Joining me today to address a very important issue is Dr. Arnold Pallay, who is a board-certified family physician and a medical director at Vanguard Medical Group Primary Practice. Thank you so much for joining us.
Great to be here, Avni.
Thank you. We have so much to talk about today, but I want to start with a simple question. What are benzodiazepines?
Well, benzodiazepines are medications that are central nervous system depressants. They kind of help bring the mood down, kind of slow down the brain so it's not overactive, kind of relaxes the brain. And it's helpful in good many situations, but it can be dangerous as well.
Yeah, and why are they so addictive?
Well, they're addictive because they interact with certain receptors in the brain. They're called GABA receptors, and what they do is they tend to get habituation, a level where you're comfortable over time with using the medication, and they give you a good feeling usually, number one, and number two, in addition, people get comfortable with it, and it's the kind of medication you've taken it before, you felt good, but you can function, so you might want to take it again, and as time moves on, there becomes that addictive tendency towards the benzodiazepines.
Yeah, and what are some of the side effects, per se, of benzodiazepines?
Well, the side effects can be many. It certainly can bring a sense of calm, which is good, but the negative that goes with that is it can cause negative effects. Seizures can occur if misutilized by these medications. It certainly can cause fatigue. If you're driving a motor vehicle, it can cause problems that you will possibly fall asleep at the wheel if you're not careful. So I never recommend anyone have heavy use of motor vehicles, truck drivers, etc., and they're on benzodiazepines.
Given the opioid epidemic, why are physicians, being aware of this crisis, still prescribing things like benzodiazepines?
Well, listen, they're an important class of medications. Let's be clear about that. So if you would lose a loved one suddenly, unexpectedly, sometimes it's hard to cope with that type of an event. So in those situations, you certainly can get great help and assistance in the short term, let's say with a funeral or event like that, using a benzodiazepine, something along the lines of alprazolam or lorazepam, which are medications that I've given to patients in the need short term. But I never want to give them long term. You want to stay off them because they have dangerous side effects.
Is there a certain amount of time? What's, I guess, defined short term? 5 days, 10 days? What's safe?
Days, week, something like that. I mean, maybe 2 weeks maximum. I really don't want to see my patients taking it long term enough so that they will then become habituated, addicted, used to it, comfortable with it, so that they're no longer functioning without taking their pill bottle open and grabbing their medication. That becomes dangerous.
Yeah, and what are some of the contraindications while taking this drug?
Well, you definitely don't want to drink alcohol, number one. As I said before, you don't want to operate heavy machinery is the second thing. There are significant interactions with other medications, so if someone's on a stimulant medication, such as medication for ADD, attention deficit disorder, or if one's on opioids for pain relief, it can be a very dangerous mix. Is a triad, as it were, between opioids, stimulants, and benzodiazepines. So they all should be used with great caution. You have to be careful talking to your provider, your physician, about how to use it, when to take it, and be extremely cautious.
So what are some of the questions you should be asking your physician when they prescribe you such a drug?
Well, you should definitely ask them, am I appropriate for the medication, number one? Are there other options that might be utilized instead? Certainly in some situations, cognitive therapy can help. Sometimes there are nutraceutical vitamins that are available. Valerian comes to mind, which is more natural and may be helpful. Other types of feedback programs, biofeedback, even yoga and other things can be utilized that may have a similar capacity to calm one's nerves as opposed to taking medication. Having said that, sometimes the physician, in concert with the patient, will decide this is the appropriate use of a benzodiazepine, and that's fine if appropriate, but used carefully with proper precautions and short term.
And what are benzodiazepines prescribed for? What kind of disorders?
Well, they're prescribed for a number of disorders. As it turns out, people have essential tremor. They can be used for people in those circumstances. As I said before, it can be used for people for sleep disorders sometimes. It can be used in addition for individuals who are very anxious, panic disorders. So there's a broad range of usages, and that's kind of the good news. It's also the bad news because it can lead to overutilization of the medications.
And what's the advice you would give a parent whose child is addicted?
Okay, so the whole area of benzodiazepines specifically and the usage in teens has become a big topic of late because it's being used more than perhaps ever. Obviously, our teens are seeing more difficulties in the world surrounding them. I think it's a fair statement. So in the right circumstances, a personal physician, a family physician, pediatrician, or a child psychiatrist might prescribe it and might use it appropriately. But again, it has to be monitored by minors, by their parents. It should be locked up, if preferably, and not made available for the teenager who, just like their parents, becomes comfortable, Avni, with this medication. It makes the kids feel good. If they feel good, they may want more of it. So you have to be the adult and say, I know you felt good on that yesterday, but maybe today we'll try other techniques. Maybe we'll go to the park, take a run, and do something else rather than look into a medication to provide the incorrect support that you may not need.
And what are some of the signs of addiction? What kind of symptoms should the parents be looking for? Well,
you still have to be aware of schoolwork issues, oversleeping in the morning, not wanting to get their schoolwork done, social isolation where they're not going out with their friends, not wanting to do sports activities. There's a number of these things that are not the usual for your child, let's say, and if they're on the benzodiazepines, it means they perhaps are overdosed or overusing the medications. The best thing is to ask your child how you're doing and saying, you know, we've used this medication a few times, but I'm concerned as your parent that maybe it's not the best choice for you long term.
How do we stop this, Dr. Pallay? How do we stop this crisis?
Well, we have to stop the crisis, I think, by really having great usage of family dynamics, making sure that we are attentive to our families, attentive to our children, what they're doing, what they're up to. There's so much overutilization of phones and videoed and so much stimulation out there. I think it starts with that. The second thing I think is we have to be careful when we're seeing our physicians, who we need to trust, a good physician, a physician of continuity. People at Vanguard, we are really attentive to knowing our patients, knowing who they are, and having that continuity so we know them. In addition, ask questions. Don't be afraid to say to your physician, is this the right choice for my child? And is this the right particular benzodiazepine? How long should they take it? What is the right dose? Sometimes patients are not asking the right questions, and I think it's a good thing. I think we're in a relationship, doctor-patient, that we're working together as a team. Team-based effort is very important.
I think that's a great point because I think a lot of these parents are not asking the right questions.
I think they should ask the questions.
Absolutely. And how do you prevent, I shouldn't say how you prevent it. Can we prevent this?
That's a difficult problem, you know, where it's just superimposed on the whole opioid epidemic out there. We have overutilization of people claiming they have attention deficit disorder. Some of it's legit, some of it's not. So a lot of it is also based on better usage of mental health. We have embedded psychiatry within our medical group, for example, where we have nurse practitioners and psychiatrists who assist the primary care physicians in better diagnostics and better care. And I think if you do that, we can be sure that if you're getting medications, such as a benzodiazepine that we're talking about, you are the right individual, you meet criteria, including neurocognitive testing, for example, and we use it very carefully and controlled. I want to make a comment, if I may, Avni, about the insurance industry. I put a little bit of concern on their back because the problem we have also is that parents like to get 90-day supplies of pills, for example. I don't want to give 90-day supplies of benzodiazepines ever. You know, it's one thing if you want to get Lipitor, which is a statin drug for 90 days. There's no major side effects. But parents will pay less, as you might know, that to get 90 pills of diazepam, which is Valium, they'll pay the same price as 90 as 10. But I want to give them 10. Please don't ask me as a physician to give you 90 pills because you're saving $12. It's not worth it. I know cost containment is important, but let's take care of your child's needs first and not give 90 pills that could be used or abused unexpectedly. Especially with controlled medications like Benzos. Exactly, exactly. And how does one safely stop taking benzodiazepines? Another important subject that we see patients come in that may have started on this medication from somewhere else, moved from out of state, and I usually talk to them about how we can get them off that. So one thing is to get the right diagnosis. Maybe they're really depressed more than they're anxious, and so a proper antidepressant is actually safer, in my opinion, than to use a benzodiazepine. The second thing is you can never stop abruptly. Do not let your child or loved one just suddenly stop the use of chronic use of the benzodiazepines. So it has to be done very gradually with a physician's guidance. So let's look for alternatives. Let's look for outposts of physical activity, biofeedback, etc. And let's look for the best diagnosis and never stop the medicine abruptly.
That's all the time we have for today. Thank you so much.
Quickly, wow.
Yeah, it goes by
Great
fast.
topic, yeah.
Dr. Pallay, it's been a pleasure. Please join us in the future.
It's wonderful. Thanks for having me.
Thank you so much.
Thank you so much. Thank you.